Hi, I have just received orders from the physician to administer some medications to my patient. So I am going to get started with that. Firstly, my patient is S. Smith, date of birth 12/5/88, with allergies to sulfa and statins. With the physician's orders, I am going to take that sheet and I'm going to verify it and compare it to the MAR record that I have, and automatically realize that there are some discrepancies to it. Therefore, I will have to call the physician before I go to the Pyxis and get any sort of medication or try to administer it to my patient. So first and foremost, the MAR has cephalexin on it. And the physician's order sheet does not. However, I do also have to express my concern to the doctor that cephalexin should not be taken with warfarin due to the fact that cephalexin will enhance the effects of warfarin, so is actually contraindicated of each other, which is probably why it is not on his order sheet. But again, I will call him and verify that as well. I also need to verify that what the correct dosage is for the multivitamin. On the MAR sheet, it says 100 milligrams. However, on the order sheet, he did not put a dosage on there. So when I call, I will verify that as well. So after calling the physician, I had him read off all the proper information, and then I read it back to him to make sure that everything was correct. We obviously established the 6 rights of the patient, right medication, right dose, right time, right route, and then I will be doing the right documentation after I administer these medications. So he did in fact verify that we will be doing the medications at 9 o'clock in the morning. It will be the metoprolol 50 milligrams by mouth once daily, the Coumadin 5 milligrams by mouth once daily, and then the multivitamin 100 milligrams by mouth once daily. So now that we know all that, I can review other aspects of my patient's chart, such as their medical history, their physical assessment, any labs or other tests that they did while they were in the hospital, and then also go over specifics of the drugs that I am administering to make sure that there's going to be no other adverse effects or interactions as we indicated with the cephalexin. So taking a couple notes on the metoprolol. This drug has an onset of an hour and peaks in 20 minutes. Because this drug is for hypertension, typically they like to take vitals beforehand to check the blood pressure, and then take vitals at least 2 to 4 hours afterwards to make sure that the drug is actually helping with the hypertension. And then for the Coumadin, this drug has an onset of 24 to 72 hours, peaks at 4 hours. And for this one, we just want to make sure that we're carefully monitoring the PT-INR to make sure that the drug is effectively working. And then for the multivitamin, there's not really a whole lot of specifics on this one because it's a dietary supplement that has multiple vitamins and minerals in it to help supplement the patient's diet and give them a little bit of boost while they're sick in the hospital. So now that we all know all that information, we can move on going to the Pyxis and getting our medications out for our right patient at the right time and doing it one medication at the time. So before I go over to the Pyxis, I'm going to wash my hands, making sure that I'm never touching any of the medications with my bare hands. When we go over to the Pyxis, I'm going to make sure that I'm scanning it in to each chart, or into my patient's chart and verifying that it is indeed the right patient again. So again, this is for S. Smith, date of birth 12/5/88, and she is allergic to sulfa and statins, which should have no effect on these drugs that I am giving her. So first and foremost, all these drugs are multi-dose drugs. So I will be taking the bottles with me, making sure that they will never leave my site. And then I will bring them back to the Pyxis to make sure that they are properly locked up when I am done with them. Okay, so first one, I'm going to scan into my patient's chart. This one is the metoprolol. The Pyxis has available 25 milligrams, but we need 50 milligrams. So I will do a quick calculation to determine that I need 2 tablets out of here. in order to get the 50 milligrams that the patient needs. The expiration date is good on the bottle as well. I'm not going to be touching these pills, and I'm going to get 2, not 3, 2 into here and screw it on top of here to make sure this goes with this medication, okay? So that is the proper medication for that one. Then moving on to Coumadin. This is our Coumadin. It does come in 5 milligram tablets. So I just need one of these. I'm going to scan it into my chart. I'm going to verify that the expiration date is okay. Not going to touch it. Put 1 tablet in my cap. Put it on top. Take it to my patient's room with me, okay? Then I'm going to get my last one. It's my multivitamin. This also comes in the 100 milligram tablet that we need. So I need 1 tablet. Going to, again, scan it into my chart, get the proper tablet, and then take it over to my patient. I did have somewhat of a live patient, aka my dog, but she got tired of me doing this video 50 times. So we have a leopard, I think. So now that I have all these ready and I verified the right dose, the right medication, the right patient, I'm going to gather all the rest of my equipment and I'm going to go administer it to my patient. Okay. So let's get all my information I need. Okay. Alrighty. So again, I have all my equipment gathered. I'm going to wash my hands before entering the patient's room. Then when I get to the patient's room, I'm going to knock on the door and then pull the curtain behind me to provide privacy. I'm going to introduce myself. Hi, my name is Ashley. I'm going to be your nurse today. The doctor ordered some medications that we need to give you this morning, if this is a good time for you. And it is. Okay, perfect. So first and foremost, I'm going to identify my patient with 2 identifiers. Miss Smith, can you verify your name and date of birth? My patient's nonverbal, so I can double check on their armband, which says S. Smith 12588. Also, if they're nonverbal, we can check with a family member or a parent and guardian in the room that can also verify their name and date of birth. Okay, so I'm going to put on my gloves to get ready to give you your administrations. It looks like you are allergic to sulfa and statins. She nods her head yes. Okay, those should have no interactions with your drugs that I am giving you. So there should be no concerns there. If you have any questions during any of this, please let me know. So first and foremost, the first drug that we are going to be giving you is the metoprolol, 50 milligrams. I'm giving you 2 tablets to equal the 50 milligrams that the doctor ordered. This is a beta blocker that is for your hypertension, which is your high blood pressure. Some common side effects of this is bradycardia, depression, constipation, and fatigue. So if you're feeling any of this, please let me know. So we're going to scan the patient's armband, scan the medication. I'm going to put it in her chart, or put it in her cup. Okay, get it ready for the next one. Next medication we're going to do is the Coumadin, 5 milligrams. So this is 1 tablet. This is for your blood clots. Contraindications for this would be if the patient has acute bleeding, if they're pregnant, or if they have an epidural catheter. This patient has none of those, so we can give this medication to them. Some of these common side effects, Miss Smith, is bleeding, lethargy, muscle pain, or purple toes. So if you're having any of these, please let me know. So I'm going to scan the armband, scan the medication, put it in the cup for the patient to take all at once. Okay. Then the multivitamin is the last one we're giving. It's 100 milligrams. Okay. I'm going to scan your armband, scan my medication. This one is just a dietary supplement to help give you some extra nutrients that you need. There aren't really any side effects to this, except sometimes it can upset your stomach. If that is the case, if you're having these symptoms, we can try to give it closer to a meal to see if it helps when there is food on your belly. Okay, so we're going to also put this into your cup as well. Okay, so now that we have all the medication, this is the right patient, all the right medications, we're going to make sure that the patient is sitting upright in the bed to avoid aspiration. Make sure that they are alert and oriented in order to take oral medication. And this patient needs a little bit of assistance, so I'm going to help her with the medication. So here you are, ma'am. Give her her medications. Okay, here's some water. Perfect. Going to make sure she takes all her medication. Looks like she did. Are you having any difficulty swallowing? No? Perfect. Okay, looks like she took all her medication. So now that we did that, is there anything else I can help you with? She said no. So with that, I'm going to take off all my PPE. I'm going to make sure I take my medication bottles with me when I leave the room and discard of everything else. And then I'm going to go lock away my medications that I have and also document all the proper documentation after being with my patient and wash my hands once again.